My name is Ben Kelly, and I am a dermatologist, and I also practice Mohs surgery and dermatopathology. So I became a dermatologist. There's several reasons for it. The first is that it's a very visual field, and that attracted me, meaning that I can walk into a patient room and evaluate them and actually come up with a diagnosis and treatment plan right there on the spot. Another reason is that there's a wide variety in dermatology. I can treat kids with acne, or I can treat adults with skin cancer. And I can also do surgery or look at things under the microscope. When patients come to see me, I want them to know that I care for them first of all. I think that the needs of the patient come first. That's something that I learned during my training, and I'm a product of my training. That's something that the Mayo Clinic taught us, and I try to involve that in everything that I do in medicine. I try listening to my patients very carefully. I want them to feel comfortable with our plan. I want them to also be involved with our plan. I'm pretty fortunate. I was able to train in Mohs surgery as well as dermatopathology. So for the most part, I split my time between Mohs surgery, which is a technique that we use to remove skin cancers, especially on faces and areas of what I consider expensive real estate. And also I practice dermatopathology, meaning that whenever somebody has a biopsy, somebody has to interpret that biopsy, and I'm the person on the other side of that. One of the interesting things that's happened in dermatology and dermatopathology is we've been able to analyze things on a molecular level. So we can actually figure out what DNA changes are happening and sometimes even tailor the treatment to the patients based on that genetic makeup. So one of my favorite parts is actually treating skin cancer. It's a pretty neat thing that somebody can come in with a skin cancer, and just within a matter of a few hours, we can actually cure that cancer and send them home. So that's one of the most rewarding parts. So I love my job because I get to treat a lot of different diseases. I can treat acne and skin cancer. I also get to see a lot of the local people. I'm actually from San Diego originally, and a lot of my patients are neighbors, and so I feel very integrated into the community that way. It's just, I feel very fortunate to be here practicing medicine where I grew up.